How to numb a sore throat. A sore throat usually starts as a tickle and increases to a severe pain every time you swallow. While you treat your other symptoms of cough and cold with over-the-counter medications, rest, and fluids, you can use these natural and over-the-counter aids to numb your throat. Most sore throats resolve on their own within 4 or 5 days, but it is also important to be aware of warning signs that it could be more serious, such as bacterial strep throat, and when it warrants seeing your physician. Method 1: Using over-the-counter products and natural methods. 1. Take an over-the-counter pain medication. Acetaminophen, Tylenol, ibuprofen, Advil, or naproxen, Aleve, have all been shown to be beneficial in reducing the pain of a sore throat. Ask your doctor before you take them if you are on blood thinners or other prescription medication. 2. Try salt water gargling. Although this has not been proven in any conventional medical trials, it is something that is known to help with sore throats. Mix 1/4 to 1/2 teaspoon of salt into a cup of moderately warm water. Swish and swirl this in the back of your mouth, near your throat, for at least 30 seconds several times a day. 3. Purchase an over-the-counter throat spray. Look for the active ingredients benzocaine or phenol, either one works, both are topical anesthetics. A throat spray can help to numb an inflamed throat for a few hours. 4. Start sucking on zinc gluconate lozenges immediately. Studies have shown that they can cut the duration of a cold by half when taken at the first signs of a cold. The lozenges will also reduce inflammation, stuffiness, and soreness. If you wait more than 2 days after your cold has begun, the zinc lozenges are unlikely to help in terms of shortening the duration of your cold. Regardless of when you take them, lozenges can help with symptom relief. This is because they typically contain topical anesthetic, which gently numbs the throat, and can also help with alleviate any dryness. Because lozenges, cough drops, stay in your throat longer than a salt water gargle or a throat spray, they are considered one of the most effective means of soothing a sore throat. 5. Use menthol lozenges. The minty mixture will numb and soothe your throat. 6. Administer a cough syrup. There are daytime and nighttime varieties. A cough syrup should coat your throat, reducing inflammation and numbing the pain for an hour or 2. Choose a cough syrup that also treats your other symptoms. Use as the package directions indicate, reducing the dose according to age and length of the cold. Don't take anti-inflammatories in addition to cough syrup, since most solutions contain them already. You can look for an all-in-one solution instead of each individual medication. 7. Drink warm beverages and/or eat cold food for the duration of your illness. Things such as warm tea and soups can be soothing to the throat, and similarly cold foods such as ice cream or popsicles can help to numb the throat and alleviate pain. 8. Make a natural tea with ingredients that are soothing for a sore throat. There are a few different options that have been shown to be helpful in sore throat. These include chamomile tea, which has soothing qualities. Hot water with a tablespoon of honey, a tablespoon of cinnamon, a teaspoon of lemon juice, and a tablespoon of apple cider vinegar. Each of the ingredients in the hot water mixture above, honey, cinnamon, lemon juice, and apple cider vinegar, have been suggested as naturally soothing remedies for a sore throat, and also potentially helpful at clearing out the infection more quickly. It is not the most tasty of mixtures, but it is worth a shot to see if it helps your throat feel better. Note that you can take the honey part on its own too. Eating honey on its own has been scientifically shown to help reduce cough, and to help with wound healing, which may be soothing for a sore throat as well. Note that honey should never be given to children under 12 months, as this puts them at risk of infant botulism. Method 2. Knowing when to see your doctor. 1. Recognize signs and symptoms of a more serious throat infection. Although viral throat infections are far more common and resolve on their own within a few days, if you have any symptoms suggesting something more serious, such as strep throat, it is important to be evaluated by a physician. If you have 2 or more of the following symptoms, it is important to see your doctor to be tested for strep throat. Fever, in particular a temperature above 100.4 degrees Fahrenheit or 38 degrees Celsius. White exudate, visible white patches on your tonsils or the back of your throat. Enlarged lymph nodes in your neck. Absence of cough, people rarely cough when they have strep throat. Absence of runny nose, common cold symptoms such as runny nose do not occur with strep throat. 2. Obtain antibiotic treatment if needed. If it turns out you do have strep throat, this will need to be treated promptly with a course of antibiotics. 3. Know when to seek help from your doctor. If you have a severe sore throat and a fever greater than 101 degrees Fahrenheit or 38.3 degrees Celsius that is not improving after 24 to 48 hours, and if anything only getting worse, it is best to see your physician sooner rather than later. Also, if you have swollen glands in your neck or the back of your throat that make it difficult to swallow or breathe, you should definitely see your physician right away, or, if you can't make a same-day appointment, be seen in urgent care or the emergency department of your local hospital. This could be a sign that something more serious is going on, like a mononucleosis, infection or tonsillitis, both of which need medical evaluation and treatment. 4. Use prescription pain medications. If you have a very serious sore throat, whether it's strep throat or otherwise, you can see your physician for prescription pain medication. Medications such as naproxen can be given to you to help you cope with the pain until your sore throat resolves.